Hello there, and welcome back to another episode of the Mental Health Ranger, where we talk about all things mental health but from a psychosocial perspective. And as you can see today, I'm out on the beach and it's absolutely freezing, but Peanut's doing a little bit of stress management himself. He's actually having a rest at the moment, but he's been digging furiously with his ball. Haven't you, Peanut? Hey, are you digging? Are you digging? Yeah. So as you can see, we all need that outlet of stress, and that's important when we think about most mental health conditions. So today I wanted to talk a little bit about bipolar, because I haven't really spoken much about it before, but yet it is spoken quite a lot about in the media, and in general. So I thought it'd be helpful to just touch upon the understanding of bipolar and what it is and what it can look like, but also what can help, because as always there are ways of managing all mental health issues, ways of managing it well and ways of managing it not so well. So one of the things that is probably the public perception is around that it's about being high and then having lows, which to a certain degree it is, but there is a lot more to it than that. And I think just due to some of the shall we say personalities on social media, over time they've kind of glamorized bipolar, and it's kind of it got to be, when I was working in the mental health teams, like the diagnosis of choice. People didn't really want to have depression, they would much prefer to say that they had bipolar, because it was insinuated that was a bit more glamorous, when in reality it is a really, really serious mental health problem. So what we always start with is looking at it through a lens of that it's problems with regulating emotions. And that really does vary by degree for certain people. So for some people, they will state that they've got a mood disorder or bipolar, and that's kind of an unofficial diagnosis, when in reality what they do have is difficulties regulating their emotions. So they experience periods whereby they are really quite excitable and very energetic and hyperactive and hypervigilant, hyper-aroused, then followed by feeling very flat and very low in mood. In contrast to that, somebody who is experiencing quite chronic bipolar disorder can experience sorry about that, Peanut's just lagging way behind, but people who are experiencing quite chronic bipolar disorder can experience sustained periods of mania that are actually very dangerous, and I've detained people and worked with people who have been so acutely manic that it borders on psychosis, or sometimes it does become full-blown psychosis, but it also becomes such a danger to their physical health, because they are so exhausted and they've possibly been so elated for about a week and not slept and not eaten and not really drinking, but then they also start to become quite destructive insofar as that it can lead to things like quite grandiose ideas, so spending lots and lots of money, promiscuity, drinking lots of alcohol, taking lots of drugs, and that is sustained for quite some time. And then that can be followed by quite a prolonged period of quite catatonic depression. So as you can see, it does vary by degree, and but there are still ways of noticing some of the earlier warning signs if you have been managing a mood disorder for some time. And like as always, I always say, what are the stresses, what are the social stresses, and look at those vulnerabilities that you already have. But also look at some of the stimulants and things like that. I used to work with somebody and when he was getting quite high, he used to drink gallons and gallons and gallons of Coca-Cola with lots and lots of caffeine in it, and drink coffee relentlessly, which obviously really, really magnified the intensity of that high. So I would always say, if you are feeling that sort of excitability and noticing that your mood is becoming quite unregulated, then look at the stimulants and start to cut them out. Prioritise sleep and maybe speak to the GP if you do need a short-term prescription of some hypnotics or something to help you sleep in the short term, but also make sure that you contact your relevant professionals. I will be doing a podcast that will go into a lot more detail, because like we say, it is a very complicated and complex mental health problem, of which, like I say, I don't think there is much support out there in terms of noticing early warning signs. So I'll go through that in another podcast. So I hope you've enjoyed that. So it's bye from a freezing cold mental health ranger and a very happy Peanut, because he's not bothered. You don't feel it whatsoever, do you, Peanut? So if you've enjoyed that, please like, share and subscribe, and we'll see you again for another episode of Mental Health Ranger. Bye!